Merkel cell carcinoma is a rare cancer from the skin. In some cases, this cancer doesn't have any visible primary site in the skin, therefore is an unknown primary Merkel cell carcinoma. And this is an even rarer entity. In some other cases, this entity is in the nodal, in one lymph node, in a regional lymph node. There is the diagnosis of Merkel cell carcinoma, but the patient doesn't have any primary site in the skin and any distant metastasis. This is a very rare clinical entity. And this entity has been described in less than 15% of cases of Merkel cell carcinoma. But if we consider just a regional stage Merkel cell carcinoma, this entity can reach up to 40% of cases. Therefore, it's important that this entity should be known by clinicians involved in Merkel cell carcinoma. I have to say, as I am not exactly an expert of skin cancers, but I am deeply involved in neuroendocrine cancer clinical research, that this entity of nodal Merkel cell carcinoma with a unknown primary site is an entity more seen in the context of a neuroendocrine cancer rather than skin cancer. So in this case, sometimes it's important, it's crucial, the differential diagnosis. And the main differential diagnosis is with small cell lung cancer. The morphological picture of a Merkel cell carcinoma in the lymph node is not so clearly different from the small cell lung cancer or other cancers. Therefore, the pathologist needs the immunohistochemistry. And in the majority of cases, the immunohistochemistry with a TTF1 negative and the cytokeratin 20 positive is the classical picture of Merkel cell carcinoma. So in our institute, we collected a large series of 55 cases published last year in the Cancers, and this is one of the largest series of a single center series of nodal Merkel cell carcinoma with a non-primary in the world, as if we have to consider that so far less than 300 cases were published in literature. So it's very, very important to spread our knowledge about this topic. What we can say that so far the treatment of this clinical entity is not clearly defined. We approached to these patients at the same way as we approach in patients with the same tumor stage, but with a known primary site, as it's recommended in the major guidelines like NCCN, for example. And therefore, we propose the lymphadenectomy. Around 70% of our patients underwent lymphadenectomy, and around half of them received also adjuvant radiotherapy. Our results were quite good compared with the same stage of Merkel cell carcinoma with no primary site, as we reached around 70% of a 5-year cancer survival cancer-specific survival rate. That is a quite high result compared with what we have in non-primary site, that it's around 40%. But if we consider patients who had received lymphadenectomy plus radiotherapy, this percentage arrives to 90%. So that's very important to treat these patients in the most curative manner, as recommended in the main guidelines.